Imagine if you knew there was something out there that could help you, your child, or your parent, that could relieve their pain and suffering, improve their quality of life, even reverse the trajectory of a debilitating disease or condition. Wouldn't you want somebody to listen, to at least be open to there being another way?
We've identified 12,555 Iowans who have debilitating medical conditions that are not being helped by traditional pharmacy therapy.
Currently, the law here in Iowa allows Crohn's disease, but not ulcerative colitis, which is definitely very frustrating because they are cousin diseases.
At one time, my disease, ehlers-danlos syndrome, was actually on the bill that was going through legislation for the approval of medical cannabis, but they did end up striking my disease.
I've been a surgical oncologist, that's a cancer surgeon, for 25 years. I also did medical oncology, so that would be, at the time I did it, mostly chemotherapy, for 15 years, and presently I am University of Iowa's oldest fellow. I'm doing a fellowship in palliative care, which is the treatment of patients, for the most part, with terminal diseases in terms of symptom management. And I've seen people successfully manage their nausea, their vomiting, gain weight using medical cannabis in preference to agents that are available by prescription.
Over 80% of Iowans agree that medical cannabis should be available to all Iowans. Current legislation only allows for up to 3% THC, and in many cases that's inadequate to treat certain medical conditions that are required for medical cannabis.
Right now, there's a limit of THC of 3%, and we need to expand that and not have a limit because everyone has a different disease. And each one of those diseases needs to have a certain amount of THC in order to make the treatment effective.
Currently, as the law stands, the amount of THC really will not help me. People with diseases like I have do need a higher THC level to have help.
This is an organic plant. It has minimal side effects, no overdose, and it has been proven successful and helped many, many people throughout the United States.
Having access to medical cannabis is very important because it's not a first-line therapy drug in many cases, but it is an adjunct drug that can be added on when other medications aren't working properly. An example might be a person who is taking a lot of opioid medications to treat pain. Some studies have indicated that a person that has been put on medical cannabis can sometimes reduce their opioid dosage by up to 50%. That's win-win because, as you know, in our country and around the state, we have an opioid epidemic going on, and whenever we can work to reduce opioid usage here in our state, that's positive outcomes.
10 plus years I was taking some kind of opioid medication. The opioids really increased the brain fog where I would lose words, and that causes so much more anxiety, which then leads to depression and isolation.
The pain in my body literally goes from the top of my head to my feet. And you just don't want to move when you hurt that bad. You don't want to move. You don't want to eat. You don't want to get out of bed. You don't go anywhere.
We want to make sure that those citizens who are just burdened with a lifelong, everyday issue, that we can provide them with some hope, some chance of alleviating the conditions of their disease states.
And one other thing too that's really important that people understand, the medication that I'm on right now, this is my 5th medication, and sometimes it can just fail for no particular reason at all. This is my last option for treatment. If this medication fails, my only other alternative would be to have a 3-part surgery and have my colon removed.
It's still a progressive disease, which my only hope now is brain surgery. And I'm not really looking forward to having another hole put in my head, so I'm not looking forward to that at all. So I'm looking for medical cannabis to help out in some of those times when I am not forced into doing such pervasive surgery and brain surgery. I hope that can delay a lot of that.
We see many patients who we can't find an effective agent. And to limit us to just these agents, which we already know may not have worked for that patient, has always seemed cruel to me.
We all live in the United States of America, so I just want the opportunity to try the same medication that others with my disease have tried and benefited from.
We can all think of a family member or a friend who's racked with a debilitating medical condition. The best thing that you can do is talk to your legislators, talk to your senators, talk to your representatives, and tell them that it's time that we move forward past this. If that was our loved one, we would certainly want that to come around for all and every citizen who can be helped by medical cannabis.
Thank you for your efforts. Thank you, thank you, thank you.